Hello everyone, and welcome to this audio podcast. This audio podcast as part of a cortical capacitor series or edition. This audio podcast as part of a MaxxaR Pathology. This audio podcast as part of a Storm Robotics production. In this audio podcast, as part of works looking at electronic patient records, library services, and multidisciplinary team meetings or MDT meetings, and where this audio podcast series looks to help answer the question: is it not time to integrate primary care for the better? So this where this sort of collaborative works looks to answer the question. This audio podcast will now this audio podcast will look into the in around healthcare services today, in around healthcare services today. So in the United Kingdom, the National Health Service or NHS, and most modern health services know nothing about this way of offering health services, but have been led, but at the same time have been led astray by open quote close quote big pharma, and the dominance of the medical model into believing that it is perfectly fine, for example, for general practitioners or primary care primary physicians to sit and wait in consulting rooms for patients to come and see them when they are ill, often when those who are ill are ill are ill and often ill and unwell to actually for example, meet meet general practitioners or family physicians in sort of in sort of in sort of sort of the primary primary healthcare setting, or quite often where these days when they are when they've joined sort of the ranks of the worried well. And so as a profession, medicine has forgotten that the title doctor is derived from docer, or docher, to which means to teach. So general practitioners within the NHS, and across the sort of developed world, where patients and carers have access to sort of the internet, or the World Wide Web, if you like, are increasingly finding that internet searches are being brought or have been brought to consultation as part of consultations or meetings, in meetings to help patients explain aspects around conditions to the general practitioner, to question aspects around conditions, and to seek the opinion of general practitioners, for example, about the information they have discovered. And so for many GPs or general practitioners or primary physicians, this is the sort of this is the sort of straw the straw that breaks the straw that breaks the camel's back. But for others, this additional presence in the consultation, in amongst consultations, is a greater is an opportunity to develop is an opportunity to develop. And in the published works from 2014, the authors have highlighted a basis where there's an opportunity develop sort of a sort of, or develop, or sort of instill a basis around library, in around library and healthcare sort of partnership. So instead of trying to curb a patient's desire for example, to study and learn about conditions and drugs, or in around drugs or drug regimens, and treatments, and the ways in which they can avoid further problems, it seems to some general practitioners or primary physicians to be to be better by far to encourage patients and come to patients and carers to become fully involved in decision making with the general practitioner concerning matters such as the diagnoses, treatment options, unwanted effects of drugs and drugs or drug regimens, drug regimens, procedures, and informed consent and options in around self care in addition to other aspects in around healthcare, in around aspects around primary care, primary care sort of services, if you like. So that draws this audio podcast to a close. The subsequent audio podcast in this series will look at sort of the literature, some aspects around the literature around health, looking at healthcare and education, and aspects in regard to healthcare and education, and the sort of offer in context of healthcare, in on the high street. That draws this audio podcast to a close. This has been an audio podcast as part of the Cortical Capacitor. This has been an audio podcast as part of a MaxxaR Pathology. This has been an audio podcast as part of a Storm Robotics production.